Hi, my name is Russ Knopp, and I'm the owner of Comfort Keepers and a proud supporter of the Hot Topics series. For the last 15 years, we have been keeping seniors safe and happy in their homes. I'd like to give a shout out right now to all the Comfort Keepers who are working around the clock to keep our clients safe and happy during this pandemic. We are proud to support the Hot Topics series in partnership with the Petoskey Chamber of Commerce. The Chamber has always been an awesome resource for us business owners. And during this pandemic, they've just stepped up their game even farther. Thank you, Petoskey Chamber of Commerce. We have Comfort Keepers. Hope you find today's presentation useful. As always, if you're in further need of assistance, please contact the Chamber. Thank you and enjoy the presentation.
Welcome to another Petoskey Strong Hot Topics focus on health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined by Lisa Peacock, the health officer of the Health Department of Northwest Michigan. And we are just going to do a really quick update on all the great things we're seeing that the health department's doing, but our little COVID surge we have, we'll call it that. Okay. Hi, Lisa.
Hello. How are you, Nikki?
I am good. Thank you for taking a few minutes with us. We appreciate it.
You bet.
So we're seeing a little surge in Northern Michigan in the last week, 2 weeks, and in our region. And what I really wanted to get across right now for our businesses and our community, as we say, stay safe to stay open all the time, is that when we see things like this type of community spread and the cases going where they're going, it's difficult on everyone. And so patience is important as much as safety is. I know that people are saying, well, I might have been exposed. I haven't heard from anybody yet. Well, if you might have been exposed, then the first thing you do is self-isolate. Mm-hmm. The health department is, you're under enormous stress. How many cases per day are you trying to contact trace to? And what does that equate to?
Most days we have 100 to 150 cases on our docket when we start the day. To approach. We're seeing anywhere from 75 to 98 or so new cases each and every day, and we can't get to them all each and every day. So there's always a backlog, and that's new. It hasn't been that way. That's been over the last 2 to 2.5 weeks that we've had this really like tenfold increase in the number of cases that we see.
And what people have to understand, so let's talk a little bit about contact tracing and how long it takes to contact trace for just one person, just one positive case.
So in public health, when we don't have a vaccine yet, hopefully soon, and we have some effective treatments starting to emerge, but before we have those things, the only tools we have in our toolbox are isolating and quarantining people who have either developed the virus or have been exposed to the virus. And so it's critical. But when we have a lower number of cases per million per day, those strategies are really effective. Like if we can find every single person who's positive, get them isolated, identify their contacts and get them quarantined, that's a really effective strategy. When our cases get where they are now, up over, the kind of threshold is 150 cases per million per day. In Emmett County, we're up over 400. Mm-hmm. So when it gets that widespread, it means that the virus is just spreading all around throughout our community. So we have to pivot our strategies a little bit, and we focus those case investigation, contact tracing efforts on those who are most at risk for contributing to an outbreak or a cluster of cases. And that's what becomes more effective in that scenario. We can't contain transmission by identifying every single person. So we have to prioritize a little bit, and we need everyone's help to do that.
Right. And by everyone's help, that means that, number one, wear your mask, practice safe social distancing, and think about your gatherings. Think about where you're going. So since we're on the topic of contact tracing, if you were to call me and say you were exposed and I had to give you where I was the last 2 days, I wouldn't want to be ashamed of saying where I was and what I was doing and how I was interacting with other people, or if I had this giant bubble. So I think people need to remember that and think about that, especially as we get closer to the holidays, that you have the ability right now as an individual watching this to make a huge impact on our community, to keep our businesses open, to keep us safe, and to keep our healthcare workers and those of you at the health department from, to not be burdened to the point of complete and total inability to be effective. You're trying.
We have to think differently right now. We just have to be really purposeful in our thinking. And you brought up some really great points. And since this is the Chamber of Commerce, I know that a lot of employers are being affected right now by people who need to be quarantined. And we know that lots of coworkers are friends, and a lot of transmission is not necessarily happening within the workplace, but it is happening when coworkers are together outside of the workplace. So we really have to be careful when we all work at the same place and then we have a birthday party for one of our children and everybody comes and we're in a house and there's, no masking and we're not distanced. That is maybe in normal times something we can do safely, but right now we can't do that safely, or we might wipe out our whole business 14 days because everybody, and what we're seeing is that many close contacts are getting sick. So there's a high percentage of people who are exposed within 6 feet for 15 minutes or more who are developing symptoms and getting sick themselves. So when you start to think about the critical infrastructure that we have in place in our communities, workers in the long-term care facilities, EMS workers, our business infrastructure that we need to keep our economy going, we have to think really purposefully about that.
We do. It's the only way you get from where we are now to the other side intact in the best way possible is by looking at it in that broad scope that every interaction we have has an effect on our economy. We are, by nature, a tourism area. And in these months that we close up a little bit, everybody's got to remember too, ski season will start soon. And we will have that influx again. And if we are not sustained and stable and ready for that, something we count on as a community economically, we have to be ready to do that. And of course, the health factor of it all is there 100%. We have to take care of those we love and keep them safe. One other thing I wanted to touch on with you too was we hear lots of questions. We get them. It's unique. We get employers that I'm like, call the health department. They'll call us and they'll say, so I had an employee whose child tested or was asked to quarantine because of an exposure at school. Can I let my employee come to work?
Mm-hmm. That's a great question. It is coming up a lot. Thank you for the opportunity to answer it for lots of people. So if your child was exposed at school in close contact to a positive case, they need to be quarantined for 14 days from the time of their last exposure to that positive case or that child who's tested positive. You as their parent do not need to be quarantined. You can still, go to work if you're able to work that out. You can still go to the grocery store. You should still be careful. Your child isn't sick. And so at this point, now, if they develop symptoms, that's a different story. Then they become a probable case and you become a close contact, and then you do need to be quarantined. But that might not happen. And until that happens, you are not quarantined. So you still can do the things that you need to do. It might not be the best time to go visit an elderly relative. It might not be the best time to go to a big gathering and potentially, expose other people without realizing it. But, you should wear your mask whenever you're out in public. You should use really good hand hygiene. You should keep your distance the best you can, but you are not quarantined. So you can come to work.
That is so helpful for so many employers and so many parents and employees as we look to how do we navigate, how do we go through this? What's the difference between quarantine and symptomatic? Now I need a test, and people need to understand those differences. And you have so many resources on the health department website. So one, and most importantly, go to them. We have all the health department links on our website, as well as all the hospital links on our website under our Petoskey Strong page. And when you update, we update to make sure that information is as much as possible out there. One thing before I let you go too, that we wanted to touch on a little bit when we talk about quarantining and the close contact and the schools and all that comes with it is that when you're looking at a non-symptomatic, so you're symptomatic, you have symptoms and you test, you have family members that are testing, you're positive, your family members are waiting for their results. That is the absolute worst time for somebody to go out, somebody who's waiting for a test result, who has an exposure. Just because you're waiting on the result and you have no symptom, the worst time to go out.
The worst time to go out. We have a lot of sad stories that happen when people do that. They really regret what they did. And sometimes they just didn't know. Nobody does it on purpose. Nobody spreads a contagious illness on purpose.
No.
But we do see people who feel very regretful when they have not stayed home waiting for their test results and have inadvertently exposed several other people. And sometimes it's a sports team, or sometimes it's a employer situation. And yeah, we must be careful.
And it's understandable too, because people think, well, I'm not symptomatic. I'm just waiting for my test results. I'm fine. So I should be okay. And
Yes.
so that's not it, just wait for the test results. And that's probably the last thing I'll leave it on, is giving everybody the instruction to be patient with test results, be patient with test availability as well. The surge has not been kind to that. Am I correct?
Yeah, no, when there's a high rising cases is rising demand on everything. So rising demand on contact tracers, rising demand on lab services, rising demand on the supply chain. So yeah, it does, unfortunately. That's why those mitigation measures are so important, to be careful in the first place, keep our distance, minimize our risk of exposure, because it is starting to heat up, and our hospitals are concerned, public health is concerned, we're all very strained, and we're all trying our best to take care of the community, but we need everybody to do their part. I just wanted to mention two really quick things related to testing, and that one is that you can't test your way out of quarantine. So it's really, really important, if you have been exposed to someone who has tested positive and you've been a close contact, meaning you've been within 6 feet for 15 minutes or more, you can get a test, and that's fine. We don't recommend testing right away after the exposure. We recommend waiting 5 to 7 days. But even if you get a negative test at that point, you need to stay home the whole 14 days. You can't test your way out of quarantine, because you could still develop the illness after that.
And that's a huge one too, because I think there is that misconception and the difference between how long it takes you to be symptomatic, and that's why quarantine is as long as it is with the intention to cover that gray space from exposure to possible you having it as well. So that's one of the best things people can do, though, is go to your website and whealth.org, correct?
Yes, and we are really working on additional resources for businesses to help with contact tracing, and to help you as a business owner or an employer know what to tell people who are testing positive or who have had close contacts. We're working on scripts and FAQs and tools that you can have at your disposal. They'll be on our website, hopefully by early next week.
Perfect. And you share them out to us, and we'll share them out all the way around to the whole business community.
Wonderful.
Thank you so much for taking the time, Lisa. I hope you have a good weekend, and everybody stay safe, stay strong, and to stay open.
Yes. Thank you so much. Take good care.
You too.